Suprarenals, as we discussed, are above the renals, also called as adrenals. Developmentally, cortex is from mesoderm, medulla is from ectoderm, that is neural crest cells. The right side suprarenal is triangular in shape, the left side is semilunar in shape. The right, of course, both these are inside the renal fascia. We have discussed this. The renal fascia splits to enclose them. Okay? Anterior relations of the right side are liver laterally, IVC medially. The posterior relations are kidney and diaphragm. Kidney below, diaphragm above. When we talk about the suprarenal on the left side, there are four things related on the anterior surface. What are they? Pancreas, splenic artery, stomach and spleen. While on the posterior side, again the relations are same, right and left. One is kidney and other is diaphragm. When it comes to the blood supply of the suprarenal gland is supplied by three arteries. Now, itna aisa kyun hai? Because thyroid also is rich in nerve supply. All the endocrine glands are rich in nerve supply. So three arteries. The superior suprarenal comes from inferior phrenic. Superior suprarenal comes from inferior phrenic. Middle suprarenal comes directly from abdominal aorta. Second last bench. तुझ्या बाजूची मुलगी हां श्रद्धा comes from middle suprarenal comes from abdominal aorta and lower suprarenal comes from renal vein. So three suprarenal, the superior suprarenal, middle suprarenal and inferior suprarenal. बरोबर? Abhijit, superior comes from inferior phrenic. Middle suprarenal comes from abdominal aorta. Inferior suprarenal comes from renal artery. Venous drainage is different. Venous drainage, right side, there is one vein, Maharudra, that vein drains directly into IVC. While left side, it drains into renal vein. ऐसा कहीं और हमने देखा था. कहाँ पे देखा था? Same situation we had seen in testes. The testes, the right side was draining into IVC. बराबर है कि नहीं? Pampiniform plexus, which forms four veins at the external, two veins at the deep ring, and then form a testicular vein which goes to IVC. But on the left side, the testicular vein was draining into renal vein. So suprarenal and testes, both on the right side, they drain. या ओळीतला लास्टचा मुलगा उभा राहा. Both on the right side, they drain into suprarenal and testes. On the right side, they drain into IVC, and both on the left side, they drain into renal vein. अभी इसका प्रॉब्लम देखो क्या होता है. यहाँ से एपिनेफ्रिन नॉर एपिनेफ्रिन आ रहा है, बराबर है कि नहीं? वो एपिनेफ्रिन नॉन एपिनेफ्रिन इधर अफेक्ट करता है, इसका वेजो कंस्ट्रिक्शन कॉज करता है. इसका प्रेशर पैम्पिनिफॉर्म प्लेक्सिस पे होके द लेफ्ट साइड पे वैरिकोसिल्स आर मोर कॉमन. Why varicocele are more common on the left side? One, because it is vertical, so gravity. This is oblique. Two, it is approximately opposite the suprarenal vein, which secretes epinephrine, non-epinephrine, which can cause vasoconstriction. So the pressure increases. In what pressure increases? The left testicular vein. उसका प्रेशर क्यों ज़्यादा रहता है? Because epinephrine, non-epinephrine यहाँ से बाहर आ रहा है. So varicocele is more common on which side? Left side. One, the vein is vertical and in close contact with left suprarenal vein, which secretes epinephrine and non-epinephrine. Suprarenal, histologically, I have already explained to you. The inner part, the medulla, it shows granules, stores the hormone. Right? Stores the hormone epinephrine, non-epinephrine. Cortex has zona glomerulosa, zona fasciculata, zona reticularis. Cortex secretes steroids, corticosteroids, but as per daily requirement. हमने हसन और गॉस का एग्जाम्पल लिया था. अगर कोई एक्सटर्नल स्टीरॉइड्स देता है तो हमारा सुप्रारिनल कॉर्टेक्स स्टॉप्स सिक्रेटिंग स्टीरॉइड्स. ओके, स्टॉप्स, उसका स्टीरॉइड का प्रोडक्शन बंद हो जाता है. देयरफॉर स्टीरॉइड डोज ऑलवेज हैज टू बी टेपर्ड. ओके, 10 milligram, then next week 5 milligram, then next week 2.5, and then stop, so that the cortex realizes that external supply कम हो रहा है, I need to start producing again. There are no granules in the cortex, no hormone is stored in the cortex, produced as per daily needs. Corticosteroids and aldosterone, all this. घड्याळाकडे बघायचं नाही. Okay, so that's the suprarenal. Applied anatomy, you can write about PHEO, chromo, CHROMO, cytoma, pheochromocytoma. Excessive epinephrine, norepinephrine, so patient will present with hypertension. बच्चू है, उसके लाइफ में कुछ टेंशन नहीं है ना, वो फर्स्ट MBBS में, फिर भी उसको हाइपरटेंशन हुआ है. Pheochromocytoma. Excessive epinephrine and non-epinephrine is being secreted. Development I have already told you. Cortex is from mesoderm. Medulla is from neural crest cells. That's all about suprarenal. Thank you so much.